When I assess a patient for treatment of cool sculpting, I find it very important to treat each area that they want treated to completion. We here at Harrington Plastic Surgery do a lot of stacking. Christina is my physician's assistant, and she's going to show you what we mean by stacking on the abdomen. So the patient has been seen and talked with about cool sculpting. Photos have been taken. We've taken her weight, and now she's back in the exam room for an assessment of what she wants treated. Our lovely patient here wants to have her lower abdomen treated. Christina is pinching the fat for its greatest give factor. Now, on most patients, when we treat the lower abdomen, we'll treat it with the Cool Advantage Plus applicator across the center of the lower abdomen, and we'll actually treat that area, as we'll show you in our video, twice on the same day. Now with this patient, she is going to grab a hold of what she doesn't like on her lower abdomen. Can you show us? Oh, she doesn't like that. Now we feel here at Harrington Plastic Surgery, in order to treat that area on her to completion, we're going to need to treat each side in a stacking fashion twice. 1, 2, 1, 2. And so Christina is now going to mark her abdomen as she would mark it if she were here for treatment. So she first grabs the skin and finds its easiest sort of flexibility to come into her hands and marks it at the apex. And she's going to do that on each side. As Christina is marking her abdomen appropriately for our plan of stacking each side of the lower abdomen, she first marked the apex, and now she's going to mark sort of the center line of where the applicator is going to be placed. She's marked out laterally where the applicator is going to stop, and then she's just going to kind of generally mark the area with an oval circle to sort of show the technician where to place the applicator in its entirety. Exactly. Great. So that is the left side of her abdomen. She's now going to mark the right side of her abdomen in the same fashion. After Christina gets this marked completely with the oval circles, she's going to show you just one last time if this patient were more narrow, where we would place the Cool Advantage Plus applicator. When assessing a patient for the upper abdomen, we find it important here at Harrington Plastic Surgery to first ask the patient what area is bothering them. And then after she's explained what's bothering her, typically my physician assistant or nurse will assess the area and mark it appropriately for treatment. Christina's first going to grab her centrally, and then she's going to grab her at an angle on each side. And she's going to decide how would it be best to place these applicators to treat this area to completion. Well, she feels that placing an applicator in an oblique fashion above the umbilicus on each side will be the best way to treat the patient. So she's going to mark at first the apex of the fat that she's going to treat on each side. Then she's going to place her template and mark exactly where that applicator is going to be placed. Now, there are many different ways that one can treat the abdomen. There is no one perfect way. We have found here at Harrington Plastic Surgery that when you do 100% overlay of areas that are bulging, we get exponential cell death and improved patient satisfaction and results. When treating the upper abdomen with stacking, we're not able to treat both sides at the same time. Because we have dual sculpting, 2 machines here at Harrington Plastic Surgery, it's not uncommon that we'll treat the right side of the upper abdomen with one machine and then a hip or flank at the same time with the other machine. After both of those areas have been treated twice, then Christina will then switch and treat the left upper abdomen and then the right hip twice. Again, this will all be done on the same day in the same setting. And now with the Cool Advantage applicators, a patient can have their upper abdomen and their hips treated all within about 3 hours. Christina is now going to mark our patient's arms. She is first going to assess the arm for where the apex of the fat lies. It typically is close to her axilla. She's going to mark the center of the apex. And she's going to not stack an arm because we don't want to treat with 100% overlap and leave any dents, but she's going to treat initially from the axilla to the center of the arm, and then from the elbow to the center of the arm, overlapping in the middle where the apex was marked for double treatment. Christina is now going to assess the patient for treatment of both her back fat, just below her bra line, and her hip area. These areas are frequently treated here in our demographics. So Christina is going to grab the apex of the back fat right below the bra line that the patient does not like, and she's going to put a mark right in the center of that apex. Now, back fat can typically be relatively fibrous, and so we always stack back fat. So she's going to mark to completion this area that's going to be treated. She uses their templates to pick the best applicator, and she will mark the center apex of where the applicator is going to be placed. So she'll draw a straight line through the center, but she'll now mark the other side for the patient, mark the apex, and then use her template to mark the vector that the applicator is going to be placed. Now, no two patients are ever exactly the same on each side, so it's not infrequent that the marks won't be exactly symmetrical. The most important thing is to mark the apex of the fat that you want to treat. She's going to grab the apex of the hip, mark it, choose the best template with respect to the curve of the template to treat that area to completion. When she grabs a hold of the fat, understanding what's going to be sort of pulled into the applicator, she's actually very much in the right spot. Great. And then she would mark the other hip in the same fashion, and we would absolutely, without question, treat both of these areas with 100% overlay in a stacking fashion. Sometimes when treating hips, and the patient only wants to buy 4 cycles, sometimes what we'll do is we'll actually treat and then treat with overlap in the middle, but try and at least get this whole area treated with the least amount of cycles possible. Christina is now going to mark the patient's inner thighs. Because she has an apex bulge of fat up high obliquely on her upper leg, we would actually stack the Cool Advantage Plus applicator, actually just the Cool Advantage applicator with the right curvature, ×2 on each upper thigh. Again, Christina would mark the apex and then she would treat it. Now, what we normally do with inner thighs, more frequently than using the Curve Advantage applicator, we typically use Cool Fit. Again, we would not do that on this patient, but we would do treatment with Cool Fit, extending down her leg, and then we would extend it down her leg a little bit more posteriorly, such to not completely overlap because we don't want to create a contour deformity. Just like the arms, we do an overlay, not of 100%. We do an overlap where at the apex of the fat, we're treating that area twice only. So Christina, can you mark on her exactly how you would do the Cool Fit in each area so that our viewers can understand? So on her right leg, she's going to mark how she would do the Cool Curve. And again, we would stack that area because she has an abundance of fat in that spot. And then on her left leg, show them how we treat most inner thighs here in our clinic. Obviously not this patient, but most. So again, we're going to run down the leg with Cool Fit posteriorly. And then after the first run of 35 minutes, we're going to move it more anteriorly with overlap in the middle. and treat it one more time for 35 minutes. Again, massaging in between. Christina is now marking this patient's outer thighs. She positions herself in front of the patient so that she can view the apex of the outer thigh bulge on each side. She will then mark the apex of the bulge on each side, and then she will use the template for the Cool Smooth applicator, which is the only non-suction applicator by Zeltique, and she will place the applicator template right over the apex and central mound of the bulge, and then she will go ahead and mark this spot for the technician to place the actual applicator. With respect to Cool Smooth, we do not want to create contour deformities. Therefore, we commonly treat this area in an overlap fashion. So Christina has marked one area, and then, as you will see later in the video when we're showing you positioning, we're going to adjust it more posteriorly so that we have not 100% stacking, but we treat each area twice in an overlay fashion. Christina is now assessing the patient for lower leg cool sculpting. Because the company has many different applicators, now including the Cool Mini, we're able to treat small areas around the inner knees. This is a common area that patients do not like, and Christina, as you can see, is sort of pinching the inner knee fat pocket. She is then going to mark the apex of this area and then use the Cool Mini template to mark where she's going to have the technician place the applicator. She'll mark that on each side. Now again, the question becomes frequently to me, would you stack this area? And it really depends upon how much fat is there. The Cool Mini applicator can be somewhat aggressive at times, and we have found in our practice it's better to treat these areas typically once and wait a good 30 to 45 days before we'll retreat that area. So Christina is now going to assess this patient for treating her calves. Please understand that this patient has fantastic calves and would not be a good candidate. But just for teaching's sake, we want to show you how we typically mark calves. And we've been treating calves in our clinic and having great success of having women's boots fit better. So we treat the calf in an oblique fashion just below the knee at the greatest apex of the fat. Christina is showing you one angle, and this patient could very well also be treated going the other direction with the other angle. What one wants to do is treat where the greatest apex and grab of the fat is located. Because we have dual sculpting, we'll place Cool Mini on the upper calf in an oblique fashion, and at the same time, with the other machine, we'll place the Cool Fit Advantage applicator on the apex of the posterior calf at its greatest amount of fat. That will be treated for one cycle, massaged down, and then Christina will show you how we treat the other side just on the same day, treating the back of the calf on the right, and then the Cool Mini now on the left. We have not been willing to stack these areas as we do not want to create a contour deformity of the lower legs.